Hi, I'm Karen Ball. I'm founder of the Sturge-Weber Foundation, and I started it 36 years ago when my daughter was born with Sturge-Weber. And Sturge-Weber is a rare disease that involves a birthmark on the face and the eye and the brain, and it causes seizures and glaucoma and hypertrophy of the cheek, overgrowth of the cheek. Sturge-Weber was identified in the 1870s by a Dr. Sturge and a Dr. Weber. One was a radiologist, one a neurologist. They noticed a very unique railroad track on the X-ray. It's a calcification that works its way up from the back of the brain to the front. And it causes a variety of issues to occur: seizures, migraines, ischemic strokes, hemiparesis, hemiplegia in the eye, glaucoma occurs, and it happens within the first 8 to 10 weeks of gestation before you know that you're really, pregnant. And they're getting better at picking it up on MRIs and ultrasounds now. They see shadows on the fetus, but it's really something that if the seizures occur within the first 6 months of life, there's a little more cognitive issues that are there. With many rare diseases, there's a certain hallmark of manifestations that are there, but then there are other little spurs that, subsets of that disease state. In our particular case, my daughter had seizures at a year. Looking back on it, you could see signs like she was a little weaker on one side. She'd be tripping, and you're thinking, like, that's kind of strange. But in our rare disease, again, it just varies on when they first express with the seizures. Some are more developmentally, capable and moving along. Others have more issues with their hemiparesis, and they have to work on physical therapies with that and occupational therapies. Some in my daughter's case, she did her own hemispherectomy. Typically, if the seizures are too bad and you're on more than 3 AEDs, they will suggest surgery. And it could be, partial to full hemispherectomy. But in her case, when she was about a year, we flew out to LA. Talk about expensive in the rare world. 1 week I flew to LA and 1 week I flew to Boston, because Boston had the laser therapy for the face and LA was just getting the PET scan research going. But anyway, we flew out to LA, and then he said, I think based on what we're finding, you need to probably do a hemispherectomy. And I was like, oh, no, I don't think so. Because she'd had one seizure, and then, was doing fine. So he agreed to let us go for another couple of months before we would look at it. Well, and sure enough, then she was the one patient that he then went on to lecture about, saying early intervention may not be what the outcome that we want, because she ended up, this side of the brain took over. This side just shut down, and this one's the hemisphere that's taken over. She has a master's degree in disability studies. She drives. She sees out of one eye about like this, but we've got her the special car with the lane changer things and a very full life. So we're very blessed. But there are many kids that have it that are very severely affected, like wheelchairs, like SMA, Duchenne kind of, thing.